1. What is the primary mode of transmission for tuberculosis? A. Direct skin contact. B. Contaminated food. C. Airborne droplets. D. Blood transfusion. Answer: C. Airborne droplets. Rationale: tuberculosis is primarily transmitted through airborne droplets expelled when an infected person coughs, sneezes, or speaks. Direct skin contact, contaminated food, and blood transfusion are not common modes of TB transmission. 2. Which of the following is the most common symptom of active pulmonary TB? A. Night sweats.
B. Hemoptysis.
C. Persistent cough lasting more than 3 weeks. D. Weight gain. Answer: C. Persistent cough lasting more than 3 weeks. Rationale: a persistent cough lasting more than 3 weeks is the hallmark symptom of active pulmonary TB. Night sweats, hemoptysis, and weight loss are also symptoms, but the most common and consistent one is a prolonged cough. Weight gain is not a symptom of TB. 3. Which diagnostic test is considered the gold standard for confirming tuberculosis? A. Tuberculin skin test (TST). B. Chest X-ray. C. Sputum culture. D. Interferon gamma release assay (IGRA). Answer: C. Sputum culture. Rationale: the sputum culture is the gold standard for confirming TB because it allows for direct identification of Mycobacterium tuberculosis. The TST and IGRA are screening tests, and a chest X-ray can suggest TB but does not confirm the diagnosis. 4. What is the recommended first-line treatment regimen for drug-sensitive TB? A. Rifampin, isoniazid, pyrazinamide, ethambutol. B. Amoxicillin, ciprofloxacin, clarithromycin, doxycycline. C. Vancomycin, linezolid, clindamycin, metronidazole. D. Acyclovir, oseltamivir, azithromycin, prednisone. Answer: A. Rifampin, isoniazid, pyrazinamide, ethambutol. Rationale: the RIPE regimen, rifampin, isoniazid, pyrazinamide, ethambutol, is the standard first-line treatment for drug-sensitive TB. The other drug combinations are used for bacterial, viral, or other infections and are not effective against Mycobacterium tuberculosis. 5. Which vaccine is used to prevent tuberculosis? A. Bacillus Calmette-Guerin (BCG). B. Pneumococcal vaccine. C. Influenza vaccine. D. Hepatitis B vaccine. Answer: A. Bacillus Calmette-Guerin (BCG). Rationale: the BCG vaccine is used to prevent TB, particularly in high-risk countries. The pneumococcal, influenza, and hepatitis B vaccines protect against other diseases and do not provide immunity against TB. 6. What is the most common site of extrapulmonary TB? A. Lymph nodes. B. Kidneys. C.
Spine. D. Brain.
Answer: A. Lymph nodes. Rationale: extrapulmonary TB often affects the lymph nodes, especially in children. The spine, kidneys, and brain can also be involved, but the lymph nodes are the most common site. 7. What is the primary function of the Mantoux tuberculin skin test? A. To diagnose active TB. B. To identify latent TB infection. C. To monitor treatment efficacy. D. To detect drug resistance. Answer: B. To identify latent TB infection. Rationale: the Mantoux test is used primarily to detect latent TB infection by identifying an immune response to Mycobacterium tuberculosis. It is not used to diagnose active TB or monitor treatment efficacy. 8. Which of the following is a common side effect of rifampin, a drug used in the treatment of TB? A. Jaundice. B. Dizziness. C. Weight gain. D. Rash. Answer: A. Jaundice. Rationale: rifampin can cause liver toxicity, resulting in jaundice. Dizziness, weight gain, and rash are less common side effects. Liver function should be monitored during treatment. 9. What is the primary role of the Bacillus Calmette-Guerin (BCG) vaccine in TB prevention? A. To prevent all forms of TB. B. To prevent drug-resistant TB. C. To prevent TB meningitis in children. D. To treat active TB. Answer: C. To prevent TB meningitis in children. Rationale: the BCG vaccine is primarily used to prevent TB meningitis and severe forms of TB in children. It does not provide complete protection against all forms of TB, especially pulmonary TB in adults. 10. Which of the following is a key characteristic of multi-drug resistant TB, MDR-TB? A. Resistance to one first-line drug. B. Resistance to at least two first-line drugs. C. Resistance to all drugs. D. Easy to treat with standard regimens. Answer: B. Resistance to at least two first-line drugs. Rationale: MDR-TB is defined by resistance to at least two of the first-line antitubercular drugs, rifampin and isoniazid. Resistance to all drugs is referred to as extensively drug-resistant TB, XDR-TB, which is even more difficult to treat. 11. Which of the following is a recommended isolation precaution for patients with active TB? A. Contact precautions. B. Airborne precautions. C. Droplet precautions. D. Standard precautions. Answer: B. Airborne precautions. Rationale: airborne precautions are required for patients with active TB as the bacteria are spread via airborne droplets. Contact, droplet, and standard precautions are not sufficient for TB. 12. What is the first step in the diagnostic process for a patient suspected of having TB? A. Perform a chest X-ray. B. Obtain a sputum sample for culture. C. Perform a tuberculin skin test, TST. D. Order a blood test for TB. Answer: C. Perform a tuberculin skin test, TST. Rationale: the first step in diagnosing TB is usually screening with a tuberculin skin test, TST, or an interferon gamma release assay, IGRA. Chest X-rays and sputum cultures are used to confirm the diagnosis of active TB. 13. Which of the following groups is at highest risk for developing active TB after a latent infection? A. Children aged 5 to 10 years. B. HIV-positive individuals. C. Pregnant women. D. Healthy adults. Answer: B. HIV-positive individuals. Rationale: HIV-positive individuals are at significantly higher risk for progressing from latent TB to active TB due to their compromised immune system. Children, pregnant women, and healthy adults are not at as high a risk. 14. What is the recommended duration of treatment for latent TB infection, LTBI? A. 2 months. B. 6 months. C. 9 months. D. 12 months. Answer: C. 9 months. Rationale: the recommended treatment for latent TB infection is a 9-month regimen of isoniazid. Shorter treatments may be used, but 9 months is the standard. 15. Which of the following is a common complication of untreated TB? A. Pneumonia. B. Respiratory failure. C. Heart failure. D. Hepatic failure. Answer: B. Respiratory failure. Rationale: untreated TB can lead to progressive lung damage, which can result in respiratory failure. Pneumonia and heart failure are not typically complications of untreated TB, although pneumonia can occur as a secondary infection. 16. Which of the following medications is most commonly associated with hepatotoxicity in the treatment of TB? A. Rifampin. B. Pyrazinamide. C. Isoniazid. D. Ethambutol. Answer: C. Isoniazid. Rationale: isoniazid is known for its potential hepatotoxicity. While other drugs like rifampin and pyrazinamide can also cause liver damage, isoniazid is the most commonly associated with a side effect. 17. A patient with active TB is prescribed a 4-drug regimen, RIPE. Which of the following drugs must be monitored for ocular toxicity? A. Rifampin. B. Ethambutol. C. Isoniazid. D. Pyrazinamide. Answer: B. Ethambutol. Rationale: ethambutol can cause ocular toxicity, including optic neuritis, which can affect vision. Rifampin, isoniazid, and pyrazinamide have different side effect profiles, but not ocular toxicity. 18. Which of the following is a sign of severe TB disease progression? A. A mild cough with minimal sputum. B. Fatigue, night sweats, and weight loss. C. Clear chest X-ray with no symptoms. D. Sudden onset of fever and chills. Answer: B. Fatigue, night sweats, and weight loss. Rationale: fatigue, night sweats, and weight loss are classic signs of severe TB disease progression, indicating that the infection is becoming more systemic. Mild cough or clear X-ray does not suggest severe disease. 19. Which TB drug is contraindicated in patients with a history of optic neuritis? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis and is contraindicated in patients with a history of this condition. Rifampin, isoniazid, and pyrazinamide do not have this effect. 20. A patient on TB treatment with the RIPE regimen complains of orange-colored urine. Which medication is most likely responsible? A. Rifampin. B. Isoniazid.
C. Ethambutol.
D. Pyrazinamide. Answer: A. Rifampin. Rationale: rifampin is known to turn urine, sweat, and tears an orange color. This is a harmless side effect of the medication. The other medications do not cause this discoloration. 21. Which of the following is a primary risk factor for developing TB? A. Obesity.
B. Smoking. C. Diabetes.
D. HIV infection. Answer: D. HIV infection. Rationale: HIV infection is the primary risk factor for developing active TB due to the immune suppression it causes. Obesity, smoking, and diabetes are also risk factors, but HIV significantly increases the likelihood of progressing from latent to active TB. 22. Which of the following is a common diagnostic imaging technique for evaluating TB-related lung damage? A. MRI of the chest. B. CT scan of the chest. C. Chest X-ray. D. Ultrasound of the chest. Answer: C. Chest X-ray. Rationale: chest X-ray is the most common imaging technique used to evaluate lung damage from TB. MRI and CT scans may be used in specific cases, but the chest X-ray is the standard for TB diagnosis. 23. Which of the following should be included in patient education for TB treatment adherence? A. Discontinue medication once symptoms improve. B. Take all medications as prescribed, even after feeling better. C. Only take the medication for 2 weeks. D. Skip doses if feeling nauseous. Answer: B. Take all medications as prescribed, even after feeling better. Rationale: it is crucial that patients complete the full course of TB treatment to prevent relapse and drug resistance. Stopping medication early can lead to incomplete eradication of the bacteria. 24. In TB treatment, what is the role of pyrazinamide in the regimen? A. To reduce cough. B. To treat drug-resistant TB. C. To kill dormant TB bacteria in acidic environments. D. To prevent liver toxicity. Answer: C. To kill dormant TB bacteria in acidic environments. Rationale: pyrazinamide is effective against dormant TB bacteria that may reside in acidic environments in the body, such as within granulomas. It is not used to treat drug-resistant TB or reduce cough. 25. What is the most effective method for preventing TB transmission in a healthcare setting? A. Wearing gloves when handling patients. B. Isolation of patients with active TB. C. Administering the BCG vaccine. D. Using antibiotics on all healthcare workers. Answer: B. Isolation of patients with active TB. Rationale: isolating patients with active TB, particularly using airborne isolation precautions, is the most effective way to prevent transmission. Gloves, the BCG vaccine, and antibiotics for workers are additional precautions, but not as effective as isolation. 26. A patient with TB is receiving rifampin. Which of the following should be monitored regularly during treatment? A. Blood glucose levels. B. liver function tests. C. Kidney function tests. D. Complete blood count (CBC). Answer: B. Liver function tests. Rationale: rifampin can cause liver toxicity, so liver function tests should be monitored regularly. Blood glucose, kidney function, and CBC are not commonly affected by rifampin. 27. Which of the following statements about the treatment of active TB is correct? A. Treatment for active TB usually lasts for 6 weeks. B. Treatment typically involves a combination of drugs for at least 6 months. C. Treatment can be completed in less than a month with appropriate medications. D. Treatment involves a single drug for short-term therapy. Answer: B. Treatment typically involves a combination of drugs for at least 6 months. Rationale: active TB treatment usually involves a combination of 4 drugs for at least 6 months to ensure effective eradication and prevent resistance. 28. Which of the following medications is a first-line treatment for TB? A. Doxycycline. B. Isoniazid. C. Levofloxacin. D. Acyclovir. Answer: B. Isoniazid. Rationale: isoniazid is one of the first-line medications used to treat TB. Doxycycline, levofloxacin, and acyclovir are not first-line treatments for TB. 29. A nurse is educating a patient who has been diagnosed with latent TB infection. Which statement by the patient indicates a need for further teaching? A. I will take my medication exactly as prescribed for 9 months. B. I will not spread the infection to others because it is latent. C. I can stop my medication if I start feeling better. D. I will follow up with my healthcare provider to monitor my progress. Answer: C. I can stop my medication if I start feeling better. Rationale: the patient should complete the full 9-month course of medication, even if they start feeling better. Stopping medication early can result in the reactivation of the infection. 30. Which of the following TB drugs can cause peripheral neuropathy as a side effect? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: A. Isoniazid. Rationale: isoniazid can cause peripheral neuropathy as a side effect, especially in patients with pre-existing conditions like diabetes or alcoholism. Pyridoxine, vitamin B6, is often prescribed to prevent this side effect. 31. What is the recommended method for diagnosing drug-resistant TB? A. Sputum smear microscopy. B. Chest X-ray. C. Culture and drug susceptibility testing. D. Mantoux tuberculin skin test. Answer: C. Culture and drug susceptibility testing. Rationale: drug-resistant TB is diagnosed through sputum culture followed by drug susceptibility testing to identify resistance patterns. Smear microscopy and chest X-rays are helpful, but do not diagnose drug resistance. 32. A patient with TB infection has a history of liver disease. Which of the following TB medications should be used with caution? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: B. Isoniazid. Rationale: isoniazid is metabolized in the liver and can cause hepatotoxicity, so it should be used with caution in patients with liver disease. Rifampin, ethambutol, and pyrazinamide are also liver metabolized, but isoniazid poses a higher risk. 33. A patient is receiving TB treatment and develops a rash and fever. What should the nurse's priority action be? A. Administer antipyretics and monitor for further symptoms. B. Continue TB medications as prescribed. C. Discontinue TB medications and notify the healthcare provider. D. Encourage the patient to drink fluids and rest. Answer: C. Discontinue TB medications and notify the healthcare provider. Rationale: a rash and fever could indicate a hypersensitivity reaction to TB medications. The medications should be discontinued, and the healthcare provider should be notified for further evaluation. 34. Which of the following statements about the transmission of TB is correct? A. TB is only spread through blood. B. TB can be spread through the air when an infected person coughs or sneezes. C. TB is not contagious unless the patient has symptoms. D. TB can only be transmitted by direct contact with an infected person. Answer. B. TB can be spread through the air when an infected person coughs or sneezes. Rationale. TB is an airborne disease, meaning it is transmitted through respiratory droplets when an infected person coughs or sneezes. 35. A patient with TB is receiving treatment with rifampin and isoniazid. Which of the following side effects should be monitored closely? A. Hypertension. B. Visual disturbances. C. Liver toxicity. D. Constipation. Answer. C. Liver toxicity. Rationale. Rifampin and isoniazid are both hepatotoxic medications, so liver function should be monitored regularly. Hypertension, visual disturbances, and constipation are not common side effects of these medications. 36. A nurse is providing education about TB treatment. Which statement by the patient indicates that they understand the importance of completing the entire course of therapy? A. I can stop the medication once I feel better. B. I will take my medication for 3 months instead of 6 months. C. Stopping the medication early can cause the TB to come back. D. I will only take the medication if I feel sick. Answer. C. Stopping the medication early can cause the TB to come back. Rationale. Completing the full course of treatment is essential to prevent the reactivation of TB. Stopping early can lead to resistance and a recurrence of the infection. 37. Which of the following patients is at highest risk for developing TB? A. A 45-year-old smoker with a history of asthma. B. A 30-year-old diabetic with poor glucose control. C. A 60-year-old HIV-positive individual. D. A 25-year-old pregnant woman. Answer. C. A 60-year-old HIV-positive individual. Rationale. HIV-positive individuals are at a much higher risk for developing active TB due to their weakened immune system. Smoking, diabetes, and pregnancy can also increase risk, but to a lesser extent. 38. A patient with TB infection asks if they can return to work after starting treatment. What is the nurse's most appropriate response? A. You can return to work after 2 weeks of treatment. B. You should wait at least 4 weeks before returning to work. C. You are contagious for up to 6 months, so you must stay home. D. You can return to work once your symptoms are gone. Answer. A. You can return to work after 2 weeks of treatment. Rationale. Most patients with TB are no longer contagious after 2 weeks of treatment with appropriate medications. They can return to work after this period, assuming they are feeling better. 39. Which of the following is a major goal in the treatment of multi-drug-resistant TB, MDR-TB? A. To complete treatment in 6 weeks. B. To administer a combination of first-line drugs. C. To prevent the development of drug resistance. D. To use second-line drugs to eradicate the bacteria. Answer. D. To use second-line drugs to eradicate the bacteria. Rationale. MDR-TB requires treatment with second-line drugs, as the bacteria are resistant to first-line medications. The goal is to effectively treat the infection while minimizing resistance. 40. What is the primary reason for directly observed therapy, DOT, in TB treatment? A. To ensure the patient receives the correct medications. B. To monitor for side effects of the medications. C. To improve the patient's adherence to the treatment regimen. D. To reduce the cost of TB treatment. Answer. C. To improve the patient's adherence to the treatment regimen. Rationale. Directly observed therapy, DOT, ensures that the patient adheres to the treatment regimen, which is critical for preventing drug resistance and recurrence of TB. 41. A patient with TB is placed on airborne precautions. Which of the following is an appropriate nursing intervention? A. Place the patient in a room with negative air pressure. B. Require all staff to wear surgical masks. C. Allow visitors without restrictions. D. Place the patient in a shared room. Answer. A. Place the patient in a room with negative air pressure. Rationale: airborne precautions require placing the patient in a negative air pressure room to prevent the spread of TB. Surgical masks are insufficient, and 95 masks are required. Visitors should be restricted as needed. 42. What is the most common symptom of active pulmonary TB? A. Shortness of breath. B. Night sweats. C. Weight gain.
D. Chest pain only.
Answer: B. Night sweats. Rationale: classic symptoms of active TB include night sweats, weight loss, fever, and a persistent cough. Shortness of breath and chest pain can occur, but are not as common. 43. Which patient is at the highest risk for developing TB? A. A college student living in a dormitory. B. A healthcare worker treating TB patients. C. A middle-aged man with hypertension. D. A child who received the BCG vaccine. Answer: B. A healthcare worker treating TB patients. Rationale: healthcare workers are at higher risk due to potential exposure. Dormitory living is a risk factor, but not as significant. Hypertension does not increase TB risk, and BCG vaccine reduces the chance of severe TB. 44. A patient with active TB is started on a 4-drug regimen. Which of the following instructions should the nurse include? A. You must take all medications together on an empty stomach. B. You should stop the medication if you feel better. C. You may need liver function tests during treatment. D. Your urine should always be clear. Report any color changes. Answer: C. You may need liver function tests during treatment. Rationale: TB medications can be hepatotoxic, so liver function should be monitored. Patients should never stop medications early. Rifampin can turn urine orange, which is normal. 45. Which of the following is a primary goal of TB treatment? A. To relieve symptoms quickly. B. To prevent the spread of infection. C. To stop all medications after 1 month. D. To reduce fever and cough only. Answer: B. To prevent the spread of infection. Rationale: the main goal of TB treatment is to eliminate the infection and prevent its spread. Symptoms may improve, but full treatment must be completed to prevent drug resistance. 46. What is a significant adverse effect of ethambutol? A. Peripheral neuropathy. B. Optic neuritis. C. Hepatotoxicity. D. Nephrotoxicity. Answer: B. Optic neuritis. Rationale: ethambutol can cause optic neuritis, leading to vision changes, particularly in color discrimination. Patients should have regular eye exams. 47. A patient on isoniazid therapy should be advised to take which vitamin supplement? A. Vitamin D. B. Vitamin B6. C. Vitamin C. D. Vitamin E. Answer: B. Vitamin B6. Rationale: isoniazid can cause peripheral neuropathy, which can be prevented with vitamin B6, pyridoxine supplementation. 48. A patient with latent TB is being evaluated for treatment. Which medication is commonly prescribed for LTBI? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: B. Isoniazid. Rationale: isoniazid (INH) is commonly used for latent TB infection, LTBI, to prevent progression to active TB. 49. A TB skin test, Mantoux test, is considered positive in an HIV-positive patient if the induration is A. 5 mm or greater. B. 10 mm or greater. C. 15 mm or greater. D. Any induration is positive. Answer: A. 5 mm or greater. Rationale: in immunocompromised patients, such as those with HIV, an induration of 5 mm or more is considered positive. 50. Which of the following statements by a TB patient indicates a need for further education? A. I need to cover my mouth when coughing. B. I will take my medications for at least 6 months. C. Once I feel better, I can stop my treatment. D. I may have regular liver function tests during treatment. Answer: C. Once I feel better, I can stop my treatment. Rationale: TB treatment must be completed as prescribed, even if the patient feels better, to prevent drug resistance. 51. What is the purpose of directly observed therapy, DOT? A. To ensure patients do not overdose. B. To improve medication adherence. C. To reduce medication side effects. D. To shorten treatment duration. Answer: B. To improve medication adherence. Rationale: DOT ensures that patients complete their TB treatment correctly, reducing the risk of drug resistance. 52. A patient on rifampin should be informed that A. It can cause urine and tears to turn orange. B. It has no interactions with other drugs. C. It should be stopped immediately if symptoms improve. D. It can cause permanent vision loss. Answer: A. It can cause urine and tears to turn orange. Rationale: rifampin commonly causes harmless orange discoloration of body fluids. Patients should be aware of this to prevent concern. 53. Which TB drug is associated with hepatotoxicity and should be used with caution in patients with liver disease? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. All of the above. Answer: D. All of the above. Rationale: isoniazid, rifampin, and pyrazinamide are all hepatotoxic and should be used cautiously in patients with liver conditions. 54. When can a patient with active TB be considered non-contagious? A. After 1 week of treatment. B. After 2 weeks of effective treatment and symptom improvement. C. After completing 6 months of therapy. D. When fever resolves. Answer: B. After 2 weeks of effective treatment and symptom improvement. Rationale: most TB patients are no longer contagious after 2 weeks of proper treatment, assuming symptoms are improving. 55. What is the hallmark histological finding in tuberculosis? A. Caseating granulomas. B. Non-caseating granulomas. C. Fibrosis without inflammation. D. Neutrophilic infiltration. Answer: A. Caseating granulomas. Rationale: TB is characterized by caseating granulomas, which contain necrotic tissue surrounded by macrophages and lymphocytes. Non-caseating granulomas are seen in diseases like sarcoidosis. 56. What is the most common site of extrapulmonary TB? A. Liver. B. Lymph nodes.
C. Heart. D. Skin.
Answer: B. Lymph nodes. Rationale: the most common extrapulmonary site for TB is the lymphatic system, particularly in the form of tuberculous lymphadenitis, scrofula. 57. Which diagnostic test is preferred for detecting latent TB? A. Chest X-ray. B. Sputum culture. C. Interferon gamma release assay, IGRA. D. Bronchoscopy. Answer: C. Interferon gamma release assay, IGRA. Rationale: IGRA is preferred for detecting latent TB, especially in patients who have received the BCG vaccine. Chest X-ray and sputum culture are used for active TB. 58. What is the most common cause of treatment failure in TB? A. Drug resistance. B. Non-adherence to medication. C. Incorrect diagnosis. D. Inadequate nutrition. Answer: B. Non-adherence to medication. Rationale: poor adherence leads to treatment failure and drug-resistant TB. Directly observed therapy, DOT, helps ensure adherence. 59. Which TB medication is associated with hyperuricemia? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide can increase uric acid levels, leading to gout. Patients should be monitored for joint pain and hyperuricemia. 60. What is the primary mechanism of rifampin? A. Inhibits DNA gyrase. B. Inhibits RNA polymerase. C. Inhibits cell wall synthesis. D. disrupts folic acid metabolism. Answer: B. Inhibits RNA polymerase. Rationale: rifampin inhibits bacterial RNA polymerase, preventing transcription and bacterial replication. 61. Which of the following is not a standard first-line drug for TB treatment? A. Isoniazid. B. Rifampin. C. Ciprofloxacin. D. Ethambutol. Answer: C. Ciprofloxacin. Rationale: ciprofloxacin is a fluoroquinolone, not a first-line TB drug. It is used in multi-drug-resistant TB, MDR-TB, cases. 62. Which population has the highest risk for developing TB? A. Individuals with diabetes. B. Young healthy adults. C. Athletes. D. Pregnant women. Answer: A. Individuals with diabetes. Rationale: diabetes weakens the immune system, increasing susceptibility to TB. Other high-risk groups include those with HIV, malnutrition, and immunosuppression. 63. What is a characteristic finding in a TB chest X-ray? A. Diffuse alveolar infiltrates. B. Cavitary lesions in the upper lobes. C. Cardiomegaly. D. Pleural effusion only. Answer: B. Cavitary lesions in the upper lobes. Rationale: TB commonly affects the upper lobes, forming cavitary lesions due to necrosis. 64. A patient on TB treatment reports tingling in their hands and feet. What is the likely cause? A. Rifampin toxicity. B. Isoniazid-induced peripheral neuropathy. C. Ethambutol-induced optic neuritis. D. Pyrazinamide-induced hyperuricemia. Answer: B. Isoniazid-induced peripheral neuropathy. Rationale: isoniazid can cause peripheral neuropathy due to pyridoxine, vitamin B6 depletion. Supplementation is recommended. 65. Which of the following statements about TB infection control is correct? A. Standard precautions are sufficient. B. Airborne precautions, including an N95 mask, are required. C. Contact precautions are needed. D. TB patients should be placed in a shared room. Answer: B. Airborne precautions, including an N95 mask, are required. Rationale: TB is an airborne disease, requiring an N95 mask and a negative pressure isolation room. 66. Which TB vaccine is used worldwide but not in the United States? A. Bacillus calmette-guerin, BCG. B. Pneumococcal vaccine. C. DTaP vaccine. D. MMR vaccine. Answer: A. Bacillus calmette-guerin, BCG. Rationale: the BCG vaccine is used in many countries but is not routinely given in the U.S. due to variable efficacy. 67. How is TB spread? A. Airborne droplets. B. Direct skin contact. C. Contaminated food. D. Vector-borne transmission. Answer: A. Airborne droplets. Rationale: TB spreads via airborne droplets when an infected person coughs or sneezes. It is not transmitted by direct skin contact or vectors. 68. What is the most common symptom of pulmonary TB? A. Night sweats.
B. Hemoptysis.
C. Persistent cough. D. Weight gain. Answer: C. Persistent cough. Rationale: a persistent cough lasting more than 3 weeks is the most common symptom of active pulmonary TB. Hemoptysis, night sweats, and weight loss are also common but occur later. 69. Which organ is least commonly affected by extrapulmonary TB? A. Brain.
B. Skin. C. Spleen.
D. Heart. Answer: D. Heart. Rationale: TB can affect many organs, but cardiac involvement, tuberculous pericarditis, is relatively rare compared to TB meningitis, cutaneous TB, or splenic involvement. 70. Which of the following is a major risk factor for reactivation of latent TB? A. Malnutrition. B. Recent travel. C. HIV infection. D. Regular exercise. Answer: C. HIV infection. Rationale: immunosuppression, especially from HIV, increases the risk of reactivation of latent TB. 71. A positive MAN2 (TST) test in an immunocompromised patient is defined as an induration of at least A. 5 mm, B. 10 mm, C. 15 mm, D. 20 mm. Answer: A. 5 mm. Rationale: in high-risk groups, e.g., HIV-positive patients, a TST induration greater than or equal to 5 mm is considered positive. 72. What is the purpose of directly observed therapy (DOT) in TB treatment? A. To prevent drug resistance. B. To shorten treatment duration. C. To avoid drug toxicity. D. To eliminate all side effects. Answer: A. To prevent drug resistance. Rationale: DOT ensures patient adherence, reducing the risk of drug resistance and treatment failure. 73. Which of the following TB medications can cause orange-colored bodily fluids? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: B. Rifampin. Rationale: rifampin commonly causes red-orange discoloration of urine, sweat, and tears. 74. Which TB drug is most associated with optic neuritis? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis, leading to blurred vision and red-green color blindness. 75. What is the gold standard test for diagnosing active TB? A. Tuberculin skin test, TST. B. Sputum culture. C. Chest X-ray. D. IGRA. Answer: B. Sputum culture. Rationale: sputum culture is the gold standard because it confirms active TB infection by detecting Mycobacterium tuberculosis. 76. What is the most effective way to prevent TB transmission in healthcare settings? A. Standard precautions. B. Airborne precautions with N95 masks. C. Contact precautions. D. Wearing surgical masks only. Answer: B. Airborne precautions with N95 masks. Rationale: TB spreads via airborne droplets, requiring airborne precautions, including N95 respirators and negative pressure rooms. 77. What is the major side effect of isoniazid INH? A. Hepatotoxicity. B. Nephrotoxicity. C. Ototoxicity. D. Cardiotoxicity. Answer: A. Hepatotoxicity. Rationale: INH can cause liver damage. Patients should be monitored for jaundice and elevated liver enzymes. 78. What is the duration of treatment for drug-sensitive TB? A. 2 months. B. 4 months. C. 6 months. D. 12 months. Answer: C. 6 months. Rationale: standard TB treatment lasts 6 months, with RIPE therapy given for the first 2 months, followed by rifampin and isoniazid for 4 more months. 79. Which TB drug is contraindicated in pregnancy? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is generally avoided in pregnancy due to potential fetal risks. 80. What is a common adverse effect of rifampin? A. Ototoxicity. B. Hepatotoxicity. C. Nephrotoxicity. D. Skin rash. Answer: B. Hepatotoxicity. Rationale: rifampin can cause liver damage and should be monitored in patients with liver disease. 81. Which of the following factors increases the risk of TB transmission? A. Crowded living conditions. B. Good ventilation. C. Proper hand washing. D. Wearing surgical masks. Answer: A. Crowded living conditions. Rationale: overcrowding increases the risk of airborne transmission of TB. 82. What is a major complication of TB in HIV-positive patients? A. Disseminated TB. B. Mild fever. C. Skin rash. D. Weight gain. Answer: A. disseminated TB. Rationale: immunocompromised patients are at high risk for disseminated TB, where TB spreads beyond the lungs. 83. Which TB drug requires routine eye exams? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis, so regular eye exams are needed. 84. What is the primary method of TB prevention? A. Vaccination with BCG. B. Regular hand washing. C. Avoiding public transportation. D. Taking antibiotics. Answer: A. Vaccination with BCG. Rationale: BCG vaccination helps prevent TB, especially in children. 85. In which country is the BCG vaccine routinely given? A. United States. B. Canada. C. India. D. Australia. Answer: C. India. Rationale: India and other high-burden TB countries routinely give the BCG vaccine to newborns. 86. What is the first-line treatment for latent TB infection (LTBI)? A. Isoniazid for 6 to 9 months. B. Rifampin for 3 days. C. Pyrazinamide for 1 month. D. Ethambutol for 2 months. Answer: A. Isoniazid for 6 to 9 months. Rationale: latent TB is treated with isoniazid, INH, for 6 to 9 months to prevent reactivation. 87. What is the causative organism of tuberculosis? A. Mycobacterium leprae. B. Mycobacterium tuberculosis. C. Mycobacterium avium complex. D. Mycobacterium kansasii. Answer: B. Mycobacterium tuberculosis. Rationale: Mycobacterium tuberculosis is the primary causative agent of TB. Other mycobacteria may cause similar infections, but are not the primary cause of TB. 88. What is the primary method of TB transmission? A. Bloodborne. B. Airborne droplets. C. Fecal-oral. D. Direct contact with skin. Answer: B. Airborne droplets. Rationale: TB is transmitted through airborne particles expelled by an infected individual when coughing, sneezing, or talking. 89. A patient with active TB should be placed in what type of isolation? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. Answer: C. Airborne precautions. Rationale: TB spreads through airborne particles, so negative pressure rooms and N95 masks are required. 90. What is the primary site of TB infection? A. Brain. B. Liver. C. Lungs. D. Kidneys. Answer: C. Lungs. Rationale: the lungs are the primary site of TB infection, but TB can spread to other organs, extrapulmonary TB. 91. Which symptom is least likely in a patient with pulmonary TB? A. Night sweats.
B. Hemoptysis.
C. Productive cough. D. Hypertension. Answer: D. Hypertension. Rationale: TB does not cause hypertension. The classic symptoms are night sweats, cough, and hemoptysis. 92. The most common diagnostic tool for TB is A. MRI. B. Sputum culture. C. Skin biopsy. D. CT scan. Answer: B. Sputum culture. Rationale: sputum culture confirms TB diagnosis, detecting Mycobacterium tuberculosis. 93. The BCG vaccine is used to prevent A. Pneumonia. B. Meningitis. C. Tuberculosis. D. Influenza. Answer: C. Tuberculosis. Rationale: the Bacillus Calmette-Guerin (BCG) vaccine provides TB immunity, especially in children. 94. What is the most common side effect of isoniazid INH? A. Nephrotoxicity. B. Hepatotoxicity. C. Ototoxicity. D. Anemia. Answer: B. Hepatotoxicity. Rationale: INH can cause liver damage, requiring liver enzyme monitoring. 95. What does a positive PPD, MAN2, test indicate? A. Active TB. B. Past exposure or latent TB. C. No TB exposure. D. Drug-resistant TB. Answer. B. Past exposure or latent TB. Rationale. A positive PPD means TB exposure, but further testing is needed to confirm active disease. 96. Which medication is included in the RIPE therapy for TB? A. Vancomycin. B. Rifampin. C. Ciprofloxacin. D. Amoxicillin. Answer. B. Rifampin. Rationale. Rifampin is a key drug in RIPE therapy for TB. 97. Which TB medication can cause peripheral neuropathy? A. Rifampin. B. Pyrazinamide. C. Isoniazid. D. Ethambutol. Answer. C. Isoniazid. Rationale. INH can cause peripheral neuropathy, which is prevented with vitamin B6, pyridoxine. 98. Which drug is the most hepatotoxic in TB treatment? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer. C. Pyrazinamide. Rationale. Pyrazinamide is the most hepatotoxic TB drug. 99. What is the duration of treatment for latent TB with isoniazid? A. 2 weeks. B. 4 months. C. 6 to 9 months. D. 12 months. Answer. C. 6 to 9 months. Rationale. Latent TB is treated with INH for 6 to 9 months. 100. TB in the spine is called A. Miliary TB. B. Pott's disease. C. Gons complex. D. TB spondylitis. Answer. B. Pott's disease. Rationale. Pott's disease is TB affecting the spine, causing vertebral collapse. 101. Which symptom is most specific to TB? A. Night sweats. B. Cough lasting 2 weeks. C. Fever. D. Fatigue. Answer. B. Cough lasting 2 weeks. Rationale. A chronic cough is a hallmark of TB. 102. Multi-drug-resistant TB, NDR-TB, is resistant to A. Isoniazid and rifampin. B. Rifampin and pyrazinamide. C. Ethambutol and rifampin. D. Isoniazid and ethambutol. Answer. A. Isoniazid and rifampin. Rationale. NDR-TB is resistant to at least INH and rifampin. 103. How long should TB patients be isolated after starting treatment? A. 48 hours. B. 1 week. C. 2 weeks. D. 6 months. Answer. C. 2 weeks. Rationale. TB patients remain infectious for about 2 weeks after starting treatment. 104. Which diagnostic test detects TB DNA? A. PPD test. B. IGRA quantiferon TB. C. Chest X-ray. D. GeneXpert MTB/RIF. Answer. D. GeneXpert MTB/RIF. Rationale. GeneXpert detects TB DNA and rifampin resistance. 105. Which factor increases TB transmission risk? A. Open windows. B. Poor ventilation. C. Wearing masks. D. Washing hands. Answer. B. Poor ventilation. Rationale. TB spreads more in poorly ventilated areas. 106. What is the primary reason TB requires multiple drug therapy? A. To reduce cost of treatment. B. To shorten treatment duration. C. To prevent drug resistance. D. To increase bacterial growth. Answer. C. To prevent drug resistance. Rationale. Using multiple drugs helps prevent resistance and ensures eradication of Mycobacterium tuberculosis. 107. Which TB medication can cause red-orange discoloration of body fluids? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer. B. Rifampin. Rationale. rifampin commonly causes red-orange discoloration of urine, sweat, and tears. 108. Which test differentiates latent from active TB? A. Chest X-ray. B. PPD test. C. Sputum culture. D. IGRA test. Answer: C. Sputum culture. Rationale: a positive sputum culture confirms active TB, whereas PPD and IGRA indicate exposure, but not active disease. 109. What type of hypersensitivity reaction occurs in a positive PPD test? A. Type 1. B. Type 2. C. Type 3. D. Type 4. Answer: D. Type 4. Rationale: the PPD test is a delayed type hypersensitivity reaction, type 4, mediated by T cells. 110. Which TB drug is most associated with optic neuritis? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: D. Ethambutol. Rationale: ethambutol can cause optic neuritis, leading to vision problems. 111. What does a negative PPD test indicate? A. No TB infection. B. Active TB. C. False positive. D. Drug-resistant TB. Answer: A. No TB infection. Rationale: a negative PPD suggests no exposure or a weakened immune response. 112. What is the most common symptom of extrapulmonary TB? A. Chronic diarrhea. B. Persistent joint pain. C. Painless lymphadenopathy. D. Seizures. Answer: C. Painless lymphadenopathy. Rationale: TB outside the lungs often presents as enlarged, painless lymph nodes. 113. What should patients avoid while taking isoniazid? A. Milk products. B. Alcohol. C. Vitamin B6.
D. Caffeine.
Answer: B. Alcohol. Rationale: alcohol increases the risk of liver toxicity with INH. 114. Which population is at the highest risk for TB infection? A. Elderly individuals. B. Immunocompromised individuals. C. Children under 5 years old. D. Pregnant women. Answer: B. Immunocompromised individuals. Rationale: immunosuppression, e.g., HIV, chemotherapy, increases TB risk. 115. Which country has the highest TB burden? A. USA. B. Canada. C. India. D. Australia. Answer: C. India. Rationale: India has the highest number of TB cases globally. 116. What is the best method to confirm TB eradication after treatment? A. Chest X-ray. B. Sputum smear microscopy. C. Negative sputum culture. D. IGRA test. Answer: C. Negative sputum culture. Rationale: a negative culture confirms TB clearance. 117. Which TB drug requires baseline and monthly liver function tests? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is hepatotoxic, necessitating liver function monitoring. 118. Which symptom suggests drug-resistant TB? A. Rapid improvement with antibiotics. B. Persistent cough despite treatment. C. Mild fever for 2 days. D. Rash development. Answer: B. Persistent cough despite treatment. Rationale: NDR-TB is suspected when standard therapy fails to improve symptoms. 119. What is a Gone complex? A. A lung lesion seen in primary TB. B. A drug-resistant TB strain. C. A type of TB skin reaction. D. A TB medication side effect. Answer: A. A lung lesion seen in primary TB. Rationale: Gone complexes are lung granulomas indicative of primary TB infection. 120. The WHO's anti-TB strategy aims to eliminate TB by which year? A. 2030. B. 2040. C. 2050. D. 2060. Answer: A. 2030. Rationale: the WHO aims to eliminate TB as a public health problem by 2030. 121. What is the most effective way to prevent TB transmission? A. Hand hygiene. B. Wearing gloves. C. N95 mask usage. D. Frequent sputum testing. Answer: C. N95 mask usage. Rationale: N95 masks filter airborne particles, reducing TB spread. 122. How is BCG vaccination efficacy tested? A. PPD skin test. B. Chest X-ray. C. IgRA test. D. There is no routine test. Answer: D. There is no routine test. Rationale: no standardized test determines BCG vaccine efficacy. 123. What is the most common cause of death in untreated TB? A. Renal failure. B. Respiratory failure. C. Sepsis. D. Cardiac arrest. Answer: B. Respiratory failure. Rationale: TB leads to progressive lung damage, causing respiratory failure. 124. What is the recommended initial TB screening test for healthcare workers? A. IgRA test. B. PPD test. C. Chest X-ray. D. Sputum culture. Answer: B. PPD test. Rationale: PPD is the standard TB screening for healthcare workers. 125. Which body organ is least likely affected by extrapulmonary TB? A. Brain. B. Liver. C. Heart.
D. Skin.
Answer: C. Heart. Rationale: TB rarely affects the heart. 126. Which TB drug is avoided in pregnancy? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is not recommended due to limited safety data. 127. What is miliary TB? A. TB with lung nodules spread via bloodstream. B. TB affecting bones. C. Drug-resistant TB. D. TB affecting only children. Answer: A. TB with lung nodules spread via bloodstream. Rationale: miliary TB occurs when TB bacteria spread hematogenously, forming millet seed-like lung lesions. 128. What is the gold standard for diagnosing active TB? A. Chest X-ray. B. IgRA test. C. Sputum culture. D. PPD test. Answer: C. Sputum culture. Rationale: a positive sputum culture confirms active TB by detecting Mycobacterium tuberculosis. 129. Which TB drug causes peripheral neuropathy as a side effect? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: B. Isoniazid. Rationale: isoniazid can cause peripheral neuropathy due to vitamin B6 deficiency. 130. What is the recommended treatment duration for drug-sensitive pulmonary TB? A. 3 months. B. 4 months. C. 6 months. D. 12 months. Answer: C. 6 months. Rationale: the standard TB treatment regimen lasts 6 months, 2 months of RIPE, followed by 4 months of INH and RAF. 131. What is the most common side effect of rifampin? A. Optic neuritis. B. Hepatotoxicity. C. Kidney damage. D. Hyperglycemia. Answer: B. Hepatotoxicity. Rationale: rifampin can cause hepatotoxicity, requiring liver function monitoring. 132. What is the purpose of directly observed therapy, DOT, in TB management? A. To prevent drug resistance. B. To reduce costs. C. To shorten treatment duration. D. To diagnose MDR-TB. Answer: A. To prevent drug resistance. Rationale: DOT ensures adherence, reducing the risk of drug-resistant TB. 133. Which population is at the highest risk for TB reactivation? A. Infants. B. Immunocompromised individuals.
C. Athletes.
D. Smokers. Answer: B. Immunocompromised individuals. Rationale: conditions like HIV, chemotherapy, and diabetes increase TB reactivation risk. 134. What is the primary reason BCG is not widely used in the U.S.? A. High TB prevalence. B. It causes severe side effects. C. It interferes with TB skin tests. D. It is ineffective. Answer: C. It interferes with TB skin tests. Rationale: BCG can cause false positive PPD results, complicating diagnosis. 135. What is the hallmark of primary TB infection? A. Lung cavitations. B. Miliary TB.
C. Gone complex.
D. Pleural effusion. Answer: C. Gone complex. Rationale: Gone complex is a lung lesion seen in primary TB. 136. What type of isolation is required for active TB? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Answer: C. Airborne precautions. Rationale: TB spreads via airborne droplets, requiring airborne precautions. 137. Which test differentiates active TB from latent TB? A. PPD test. B. IGRA test. C. Chest X-ray. D. Sputum culture. Answer: D. Sputum culture. Rationale: only sputum culture confirms active TB, whereas IGRA and PPD detect exposure. 138. Which TB drug requires monthly vision testing? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: D. Ethambutol. Rationale: ethambutol can cause optic neuritis, necessitating regular vision checks. 139. What is the most common extrapulmonary site of TB infection? A. Skin.
B. Bones.
C. Lymph nodes. D. Intestines. Answer: C. Lymph nodes. Rationale: TB commonly affects the lymph nodes, leading to scrofula, tuberculous lymphadenitis. 140. What is the first-line treatment for latent TB? A. Rifampin for 4 months. B. Isoniazid for 9 months. C. Ethambutol for 6 months. D. Pyrazinamide for 2 months. Answer: B. Isoniazid for 9 months. Rationale: isoniazid monotherapy for 9 months is the preferred latent TB treatment. 141. Which of the following is a classic radiologic sign of reactivated TB? A. Pleural effusion. B. Gone complex. C. Apical cavitary lesions. D. Diffuse infiltrates. Answer: C. Apical cavitary lesions. Rationale: reactivated TB typically presents with cavitations in the lung apices. 142. What is the most common symptom of active TB? A. Chest pain. B. Night sweats. C. Weight gain. D. Runny nose. Answer: B. Night sweats. Rationale: classic TB symptoms include night sweats, fever, cough, and weight loss. 143. What is the primary mode of TB transmission? A. Fecal-oral. B. Bloodborne. C. Airborne. D. Direct skin contact. Answer: C. Airborne. Rationale: TB spreads via airborne droplets expelled during coughing or sneezing. 144. Which TB drug can cause hyperuricemia and gout? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide inhibits uric acid excretion, leading to hyperuricemia. 145. What is a serious complication of untreated TB? A. COPD. B. Pulmonary fibrosis. C. Respiratory failure. D. Asthma. Answer: C. Respiratory failure. Rationale: Advanced TB can cause extensive lung damage, leading to respiratory failure. 146. What is the most effective TB prevention method in endemic areas? A. BCG vaccination. B. Wearing gloves. C. Taking antibiotics. D. Avoiding dairy products. Answer: A. BCG vaccination. Rationale: BCG provides partial protection against severe TB in high-risk areas. 147. What does MDR-TB refer to? A. TB resistant to rifampin and isoniazid. B. TB that spreads faster than usual. C. TB with no symptoms. D. TB only affecting the elderly. Answer: A. TB resistant to rifampin and isoniazid. Rationale: MDR-TB is resistant to both isoniazid and rifampin, requiring second-line drugs. 148. What is the recommended isolation period for a TB patient starting treatment? A. 48 hours. B. Until symptoms resolve. C. Until 3 consecutive negative sputum smears. D. 1 month. Answer: C. Until 3 consecutive negative sputum smears. Rationale: patients remain infectious until 3 negative sputum smears confirm non-contagiousness. 149. Which factor increases the risk of drug-resistant TB? A. Poor medication adherence. B. High-protein diet. C. Exercise. D. Early treatment initiation. Answer: A. Poor medication adherence. Rationale: incomplete treatment allows Mycobacterium tuberculosis to develop resistance. 150. What is the tuberculin skin test measure? A. Exposure to Mycobacterium tuberculosis. B. Active TB infection. C. Drug resistance. D. Immune response to treatment. Answer: A. Exposure to Mycobacterium tuberculosis. Rationale: a positive PPD test indicates past or current TB exposure, but does not confirm active disease. 151. Which first-line TB drug can cause discoloration of body fluids? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: B. Rifampin. Rationale: rifampin turns urine, tears, and sweat reddish-orange, which is harmless. 152. What is the function of pyrazinamide in TB treatment? A. Prevents bacterial cell wall synthesis. B. Inhibits RNA synthesis. C. Lowers pH inside bacterial cells. D. Inhibits folate metabolism. Answer: C. Lowers pH inside bacterial cells. Rationale: pyrazinamide disrupts TB bacteria by reducing intracellular pH. 153. Which test confirms latent TB? A. Sputum culture. B. Chest X-ray. C. IGRA test. D. Bronchoscopy. Answer: C. IGRA test. Rationale: IGRA, interferon gamma release assay, detects latent TB by measuring immune response. 154. What is a major concern when treating TB in HIV-positive patients? A. Drug interactions with antiretrovirals. B. Faster bacterial clearance. C. Less infectiousness. D. Shorter treatment duration. Answer: A. Drug interactions with antiretrovirals. Rationale: rifampin interacts with antiretrovirals, requiring dose adjustments. 155. Which organ is most commonly affected in extrapulmonary TB? A. Liver. B. Brain. C. Kidneys. D. Lymph nodes. Answer: D. Lymph nodes. Rationale: lymph node TB, scrofula, is the most common extrapulmonary manifestation. 156. What is the primary role of ethambutol in TB therapy? A. Prevents bacterial cell wall synthesis. B. Inhibits DNA replication. C. Disrupts mycolic acid synthesis. D. Blocks folate production. Answer: C. Disrupts mycolic acid synthesis. Rationale: ethambutol inhibits cell wall formation by targeting mycolic acids. 157. What is the key symptom distinguishing active TB from latent TB? A. Weight gain. B. Productive cough. C. Skin rash. D. Headache. Answer: B. Productive cough. Rationale: active TB typically presents with a chronic productive cough, often with hemoptysis. 158. Why is vitamin B6, pyridoxine, given with isoniazid? A. To prevent hepatotoxicity. B. To reduce neuropathy risk. C. To improve drug absorption. D. To enhance bacterial clearance. Answer: B. To reduce neuropathy risk. Rationale: isoniazid depletes B6, leading to peripheral neuropathy. 159. Which TB drug is contraindicated in pregnancy? A. Rifampin. B. Isoniazid. C. Streptomycin. D. Pyrazinamide. Answer: C. Streptomycin. Rationale: streptomycin is an aminoglycoside that can cause fetal ototoxicity. 160. What is the primary aim of contact tracing in TB control? A. To diagnose TB early. B. To monitor treatment adherence. C. To prevent drug resistance. D. To identify and treat exposed individuals. Answer: D. To identify and treat exposed individuals. Rationale: contact tracing helps detect TB early in exposed individuals, reducing spread.